Welcome to Champions of Care, brought to you by Oakwood Healthcare. I'm Mary Zatina. Today, we're talking about prostate cancer. It is the most frequently diagnosed cancer in men in America today. We're going to talk about what causes it, all the symptoms and treatment options. And with me in the studio today is a urologist who practices in Canton and Westland, Dr. Surendra Kumar. Welcome to the show, Dr. Kumar.
Thank you.
So tell us, what is the prostate and how is it supposed to function in a normal, healthy man?
Prostate is a normal gland which is present, if I can show you in the model, at the lower end of the bladder. And the urine goes right through a channel which goes right to the middle of the prostate and on out. And its normal function is to make secretions which normally support the sperms.
And so what goes wrong in some men that they develop prostate cancer?
We don't really know what causes prostate cancer. It appears to be age-related, and as men get older, the incidence of developing prostate cancer increases to the extent that people in their 90s, for example, almost 80% of them will have a small amount of prostate cancer. If you did autopsies in those people, you would find those.
Really?
Yes.
So are there warning signs other than the fact that a man is getting older?
Generally not. Most warning signs come after the prostate cancer starts causing symptoms, and most of the time by that stage they would be more advanced. So most cancers in the last at least 20 years have been picked up, at least in the United States, with PSA screening and rectal examination screenings for looking for prostate cancer.
Now let's talk a little bit more about PSA screenings, and actually I'd like to understand what are all the ways that prostate cancer is diagnosed?
Prostate cancer has been diagnosed mainly by PSA screenings starting in the early 90s. There are certain normal levels which are set up, and PSA is actually an enzyme which is normally produced by the prostate, and in the presence of cancer the levels increase, and by screening we can measure the levels, and if the levels are beyond a certain range, we get more suspicious that that might be a cancer, and that would lead to a prostate biopsy. And that's really the only way you can diagnose prostate cancer, is once you do a biopsy, sample the prostate, look under the microscope to find out if there's cancer or not.
So that PSA test is always the first step?
Correct. Along with physical examination of the prostate by a rectal examination. And
that should happen every year?
The usual recommendation is to start routine screening after the age of 50 years on once a year. And for African Americans, the recommendation is to start at age 40 years once a year after that. And also, people who have a family history of prostate cancer should also have the screening started at about age 40 on.
And that PSA, what does that stand for, PSA?
PSA stands for prostate-specific antigen, and it's an enzyme which is normally produced by the prostate gland.
Now, if a young man is listening to this program, watching this program today, and he never wants prostate cancer in his life, are there lifestyle changes that he can make to affect his chances of contracting this type of cancer?
Unfortunately, there is no definite information or knowledge on what one could do or not do to totally prevent prostate cancer. However, there are lots of recommendations which go along the lines of generally good nutrition, including low-fat diets and low or a limited amount of red meat in the diet, to take and vitamins, and vitamin D particularly, but all those recommendations are really not completely proven, but as general guidelines.
Now, we find so often that it's just really hard to get men to get any kind of physical in the course of a year. What advice do you have to men who are watching this show, or the women who love them, to make sure those fellas get in and see probably first their primary care physician before they come to see a specialist like you?
Right. Well, what I would say that is that in the last 20 years there have been major advances in the treatment of prostate cancer, to the extent that currently most or vast majority of prostate cancers are actually curable. And even though it is commonly detected cancer, or one of the most commonly detected cancers in men, it is now entirely curable to a large extent. So that's a hopeful sign that if we do find something, that will be able to cure it. It's a different matter if you were screening for things for which you couldn't do anything anyways, which does make it's not as persuasive to go through the pain of having, biopsies and examinations and all that. But since it remains a common problem and remains a serious problem, and since it can be cured, it makes all the sense to have that done.
So you're saying this is highly curable and there's
Yes.
been major advances. Well, when we come back from a short break, we're going to talk about some of those major advances in treatment.